Earlier, I spoke with Washington Post reporter David Nakamura about which Republican senators will be crucial in making sure no one else moves into that no column.
I mean, I think what you're looking at right now is if Ted Cruz, who has put forward an amendment to make the bill more conservative, could potentially bring over some more of the conservative members who've had concerns about the bill really not going far enough in its cuts to Medicaid and other programs and saving money. If that is successful, that effort from Cruz, then you're looking at a handful of more moderate senators, and they include Dean Heller in Nevada, and a number of others, Rob Portman in Ohio, a number of others who are sort of in swing state territory and are feeling pressure really from both sides. And so, what's interesting is, McConnell hoped to get a vote this week. It's not clear whether they would have had the numbers, so it's not clear whether this delay over Senator McCain's health could help or hurt them. But what we know is that they're really struggling to get the votes. And you saw over the weekend more governors, including in Nevada, where Dean Heller, the senator, is under this pressure. The governor of Nevada has been very critical of this bill. And you're going to see more and more of that pressure continue to hit these members who are in swing states and on the fence on this. So it's going to be a real chore for McConnell. And the question is, how much support are they going to get from the White House to get out there and really turn these key senators their direction?
So let's talk about that presidential support. What form will it take? How will it roll out? Right. What role is the president going to take in getting this bill passed?
That's very interesting. Typically on a big legislative push that was central to a president's campaign as recently as just 9 months ago, this would be something where you'd see the president out, maybe on the stump, promoting the sort of their Senator McCain's bill. But right now you have the White House really kind of this week focused on what they're saying is Made in America week, jobs, changes to, they're trying to make to help American businesses. They're not really talking about health care. And there's some sense that, the senators don't want Trump out there because he is divisive. His approval rating is low. And he tends to sort of say things that are on the extremes when they're trying to get moderates to come aboard. So you have, members of the White House working closely with Capitol Hill, including the Vice President Pence, who, of course, had been a Congress member. But you may not see the president really out there talking robustly about this bill and really selling it.
More Americans believe that health care is a major issue than Russia, and yet in political Washington, Russia is a major topic, and it seems to overshadow everything else. Right. The president this morning defending his son's meeting with a Russian lawyer, calling it just politics. Is it just politics, or are these revelations, are these emails a turning point?
Well, I don't know if they're a turning point, but what we've seen now is either the president to say, anybody would have taken this meeting to get dirt on their opponent. Just last week when this meeting was first sort of reported on, first by the New York Times, Don Jr. said, well, hey, this is not a big deal. We were talking about an adoption program. And we've known since then that that was not a clear and really honest explanation of what the point of this meeting was. And so the more that the White House tries to deny or, sort of gloss over this, and the more they're contradicted by actual emails and actual evidence, the more it's going to look like they're hiding something. And so they could say, look, this is not really a big deal. This is being overblown. But their explanations have not squared with sort of the facts of the case. And I think it's going to continue. We had the president's lawyer on some of the Sunday shows yesterday talking about, the Secret Service would have blocked this meeting if they found it inappropriate. Then the Secret Service saying, wait a minute, Don Jr. was not even under our care at the time or our protection at the time. So again, all these misstatements are leading to more questions about what is going on. And I think that's why this case is going to continue to be at the center of debate here in Washington.
We mentioned that Thursday will mark 6 months in office for President Trump. A new poll out yesterday shows he has a 36% approval rating. That is the lowest in 70 years of polling from that particular poll. At what point do Republicans calculate that they need to distance themselves from the president if they want to stay in office?
That's just a devastating number. Trump was out there twitting, it's almost 40%, really not that bad. No, it is bad. It's well under 40%. And as you said, it's extremely low. Presidents Obama and George W. Bush were basically in the high 50% approval ratings at this time of their presidency. This is a time where you're coming off your mandate after election victory. To answer your question, I think what's key here is that you have this health care bill in the balance, potentially Republicans turning to tax reform next. I think they're not going to turn en masse or even in significant numbers on the president until they feel that his problems and his popularity is really cramping their agenda. And so right now they're still hopeful to move forward on some of these, and they need to work closely with the White House. And I think you're going to see them sort of circling the wagons, depending on what happens in this investigation into the Russia connections from the special counsel Robert Mueller to other revelations potentially in the press, or to other statements the president makes, whether it's on Twitter or social media, that could then potentially start to drain his support on Capitol Hill among Republicans.
All right, David Nakamura of the Washington Post, thank you very much.
Thanks a lot.